This is a new illness for the world, but we deal with illnesses like this pretty much all the time. We're constantly in emergency preparedness mode, whether it's preparing for a pandemic like COVID-19 may become, whether it's something like we saw previously, H1N1, even a really bad influenza season can be very stressful on the healthcare system. So we're constantly preparing for that, all the way up to the possibility of a Cascadia event, for example, along the coast. It all ties into our emergency preparedness efforts. And all of that is going on in the background at any time, just day to day. Now, when we get notification of a particular disease that's out there that's ramping up, like we have with COVID-19, we then kick into gear with task forces. They started meeting once a week. Now they were meeting every other day. Now they're meeting daily because our information is different. Every day we adjust and we figure out. The other thing is our supply chain, which is very important for protection of our employees and patients, to make sure that we have the right personal protective equipment to wear when we're evaluating folks who may be infectious to us. And again, that is a daily sort of thing. We always have this protective equipment around, but particularly when things are heating up and we may be seeing more of a certain type of airborne illness, for example, a respiratory illness, we want to make sure that we have plenty of that equipment for our clinicians at all times. So basically, we advise people to go to the emergency department when they're having an emergency. And so that can be, in this particular case, if we're talking about a respiratory type illness, maybe you have very high fever and lower respiratory symptoms, something like cough and shortness of breath. Whenever you're in distress, the emergency department is there for you. That's why it's called an emergency department. And so that's what we really want to save our emergency departments for, is for those emergencies and for those times that are really above and beyond. Other than that, we have other levels of care. If people are in fact worried and want to have a conversation with their doctor, that would be an awesome time to see a primary care provider. If they have milder symptoms and just want to check in, that might be a great time to go to a walk-in clinic or an urgent care. But the emergency department should truly be reserved for those times when it's truly emergent. Severe pain, trauma, any type of distress or serious injury.
So not your, more common coughs. You have a cold and a cough. You're talking really serious cough where you just cannot catch your breath.
Right, where you just can't breathe. Okay. Those are the times to really utilize the emergency department. And perhaps that's the time, too, when you should be calling an ambulance, when it's truly distressing and life-threatening. We want people to be safe, but choose the right level of care. If a person believes that they have had an exposure to COVID-19, to the coronavirus 2019, there's some pretty specific things that would get them to the point of testing and really wanting to investigate this. So let's just go over that. Okay. So that would be a fever and some lower respiratory symptoms like cough and shortness of breath, accompanied by an international travel history to areas that have had outbreaks, or known close contact of a person who has been diagnosed via a laboratory test with COVID-19. So if people have those sorts of risk factors, then yes, we want them to call ahead so that we know they're coming, so that we can be prepared with the right personal protective equipment on our people. We'll want to make sure that we mask them when they come in to protect their own cough and any other secretions or our airborne droplets, we'll want to make sure that we have the right room for them available. If we're evaluating an airborne illness, ideally we'd want a negative pressure room for a person, something that doesn't allow droplets and those types of airborne viruses to go out, that it keeps it within the room. So, so all of that we would want to prepare for. So if somebody believes that they've truly had this level of exposure and are symptomatic, then that's the things that we would need the heads up for. Absolutely. If they're non-emergent questions, what we hope is that people can use some of the most amazing available resources that are out there. For example, the OHA has a wonderful website that, and people can, we'll give them the actual website address, but they can even Google just Oregon Health Authority and coronavirus and get a ton of information about what's going on and where infections are and possible persons that are under evaluation and things like that. Also, 211 is a wonderful local resource, again, for local information. But if people have questions that aren't getting answered, there's certainly MyChart and an email that maybe we can respond back to very quickly would be a wonderful avenue. I do want people to keep in mind that whenever something like this happens, our healthcare resources are stretched pretty thin. And so it may take some time for folks to get back to you, but if everybody can just be patient, there's an awful lot of information that's out there, a lot of really good information. Again, the Oregon Health Authority and our own Lincoln County Public Health really trying to make information available to people. So a lot of times that's a good first effort.